When a fire breaks out, there's no one you trust more than a firefighter. But what about in a medical emergency? Believe it or not, more than 70% of the calls firefighters respond to in the United States and Canada are medical emergencies. In a medical emergency, you dial 911. You expect help to arrive, and in most communities, it's a fire truck that's first on the scene.
Contrary to popular belief, firefighters play a significant role in the emergency medical service system. Firefighters, trained as EMTs and paramedics, are often the first responders to any emergency in virtually every community. They respond to vehicle accidents, hazardous material calls, not just emergency medical calls. Their availability and expertise is critical in any emergency, whether it be fire or medical, when every second counts.
Firefighters, cross-trained as EMTs and paramedics, deliver the same emergency medical services as single-role paramedics, assessing the patient's condition, identifying existing medical problems, administering state-of-the-art care, and often transporting them to the hospital.
Firefighters get an additional training of between 1,200 to 1,800 hours on top of the fire training to become paramedics. They actually get classroom training, plus they get hands-on training. For example, starting IVs, doing 12-lead EKGs, being able to manage the airway, which is very important, on top of what they do as firefighters. As the safety net for healthcare, paramedics and pre-hospital providers will always be the front line as far as delivering care in the community to every citizen whenever 911 is dialed.
Firefighters can also perform in ways that single-role paramedics can't, like securing accident scenes and rescuing someone trapped in a car.
Firefighters that are cross-trained, unlike just straight paramedics, can do a lot of things. What they do is they handle the whole incident from A to Z. Whether you're talking about extrication from a vehicle, a water rescue, an elevated rescue, you're going to take the patient and you're going to take them from taking them out of a harmful environment, packaging them and transporting them all the way to the hospital. It's seamless. It's the best thing to do for the patient. Firefighters can do this because they have a lot of different authorities that straight EMS people do not have. They have certifications and training that these people don't have, and they also arrive at the scene with equipment that's not brought to just a straight EMS scene. In addition, they can quickly call for backup of other units that also are specially trained to assist them when needed, and it's very quick.
Because fire stations are strategically placed in communities, EMS-trained firefighters are the best option for rapid response emergency medical care. This is especially important as the number of uninsured and underinsured continues to rise.
Many people think that this is a new concept, that fire-based EMS or joint fire EMS is a new concept, when in actuality we've been doing it since 1912. It's not something new to us, we've been doing it for a long time, and it has proven its efficiency over time. What we see is the efficiency, the built-in efficiency of having two disciplines that are joined together, that are able to come as one and utilize both of their skill sets to really treat the patient, because what it comes down to is patient treatment. What is best for the patient? And we have the ability to treat our patients quickly, and it provides an efficiency for the city because they've only got to pay one set of people to do two different jobs. It makes sense that our firefighters can be cross-trained as EMTs or paramedics to provide that patient care right from the start, from the initial call to right to the hospital and transport.
Whether it's a fire or a medical emergency, you can count on the firefighters who respond to your call for help. In light of the continuing health insurance crisis in the United States, many are relying on the emergency medical system as the safety net for community health care, in some cases, primary health care. As more communities focus on their community EMS systems, the IAFF and IAFC are spreading the word about the demonstrated success of this innovative model, which has also been demonstrated to solve ambulance resource problems being experienced in a number of Canadian communities. The IAFF and IAFC believe that firefighters already have a direct and lasting impact on public health and safety by optimizing the use of the emergency response system already in place in our communities. Many jurisdictions are even realizing the usefulness of these highly trained emergency responders by efficiently utilizing their firefighters for illness and injury prevention efforts.
The IAFF mission is to promote emergency medical services in conjunction with the fire services that we already provide by providing additional services such as emergency medical care for the elderly, immunization programs for the young, drown-proofing programs, and just a natural extension of our community services in the communities that we already serve. Other programs that the IAFF is supporting and encouraging our affiliates to provide in their communities also have to do with hypertension screening, high blood pressure for their community members, car seat programs that help parents place car seats in their cars to provide protection for their children. And with the elderly, we'll go to their homes and review their house for potential hazards, so there's less chance of slip and falls for them. So we try and reach all segments of the community that we work in and provide those type of additional services on top of basic fire and EMS.
Firefighters know their community, they know their areas, they know their people, they know their homes, they know their houses, and it's just deliverance of medical care already spread out throughout your community. Today, firefighters already provide the first step in public health, social welfare. Why not just let them continue all the way through to the emergency room? In today's emergency medicine, time is critical for survivability in the treatment of heart attack, stroke, and trauma. Having fire stations deployed throughout the community provides for the quickest, rapid response and treatment and transport to an emergency room facility.
As demand for medical services increases, firefighters are rising to the challenge. The emergency response system is already in place. The trained personnel are in the stations. It's time for community leaders to begin utilizing both of those assets efficiently and effectively to raise public health in their communities.
In the future, fire-based EMS will continue to grow. Communities are already enjoying the efficiency of those systems throughout the country. One thing about us, we will go regardless of your ability to pay. We're going to be there when the bell hits, we're going to respond. In the future also, politicians and community leaders need to use these systems to provide the most efficient system they can to the taxpayers, which is fire-based EMS.
Within my lifetime, I have seen paramedics and pre-hospital providers going from just basic EMTs to paramedics. Now paramedics can actually deliver drugs that we only used in the operating room to anesthetize and sedate patients before the airway is managed. I think this is such an amazing transformation of having new science translated into best practices closer to the patient. Paramedics are learning more, they're able to do more. They do 12-lead EKGs. With online medical control, they can actually deliver clot busters to dissolve clots in patients' hearts and give their heart back oxygen. They save brains, they save hearts, they save lives.
For more information, visit IAFF.org and IAFC.org.